So just to give a quick review of research at JDMI, research is integral to UHN and to JDMI in particular. We have about 8 clinician scientists and many more clinical investigators who are affiliated to one of the research institutes at UHN. And if I were to look back the last few years, I think on an average, we have over 300 publications in peer-reviewed journals with over 10,000 citations per year. We, in JDMI, we do provide protected research time to our radiologists to enable research. And in general, I would say we categorize them into 2 categories: the Research Leadership Award, whereby an individual may be successful in 40 to 50% of their time protected for research, while we have the Research Award where there might be other clinical investigators who may be successful in 10 to 30% of their time to enable research. And our group practice kind of supports the protected research time. In addition, we have our JDMI Research Office, which provides biostatistical support, also provides support for grant writers, for our researchers in the department. And we also have the Academic Incentive Fund, which is supported by the Research Office, whereby investigators may require a small amount of monies to do a pilot study, which can then enable them to go on to apply for bigger grants. So that's another indirect way that we can support our radiologists at JDMI. So I think the question is, why is research important to medical imaging? And I would say that radiology has really become central and integral to clinical care at every step, whether it is in diagnosis or determining the disease stage and extent, or even the new treatment techniques. It makes it all the more important for us as radiologists to be at the forefront, for innovation and improvement diagnostic and therapeutic options for our patients to improve clinical care. So for research to be successful in any department, I think the first and foremost is that the leadership should be committed to research. And for this, I would thank our department, our radiologist in chief, Dr. Schmidt, who's committed and has been supporting research in the department, our group practice, who supports us and providing protected research time. Importantly, we need to have motivated individuals in the department, and then to support them either in the way of mentorship or providing resources. And in our case, I would say the resources would be in providing them protected research time, or the initial funding through the AIF or the biostatistical support that we can provide. It is important for our researchers to to build those multidisciplinary teams around to be able to do impactful research. And I think it is also important for the departments to have a strategic plan, and it is important for the researchers to align themselves in that departmental strategic plan to be successful. If I were to choose 3 key areas of research in radiology over the next 10 years, I would choose perhaps primarily AI. We've seen the growing influence of technology in radiology over the last many years. There's been a rapid rise of AI usage, which is a clear indicator. And I think it's very important for us to overcome the obstacles in implementation of these AI techniques in the future. The second area that I would pick on would be molecular imaging and perhaps theranostics, whereby one can pair diagnostic biomarkers with the therapeutic agents to target disease cells. An example would be the PSMA targeted radioligand treatment for metastatic prostate cancer. And the third area, as a key area for research advancements over the next many years in radiology, I would say, is new interventional techniques, to minimally invasive techniques. And it's important for us, again, to be, as radiologists, to be at the forefront of this, to bring evidence-based medicine to improve patient care in the future.